Hello everybody, and welcome to AI and Data Ethics, Lecture 2, Part 3, which is what I call Class 6. I hope you're getting the hang of that by now. Practical Ethics, Guidelines and Policy, the third part and last part of this part of the course. I'm Paula Boddington. We're going to continue our theme of looking at what we can learn from other areas of professional ethics, this time focusing on the content of codes, including general principles and values, where we can source them and how we can develop them in relation to AI in particular. As I've mentioned before, speed is a very frequent theme in talk of AI, in fact in talk of technology in general, but it's particularly the case that it's mentioned in relation to talk of AI, often in terms of a race. So we're going to consider the content of codes of ethics for AI and some common themes and differences between different codes, and ask the question, how should we determine the content? What can we learn from other examples, such as the codes of medical ethics? We looked at medical ethics briefly in the last lecture, and we're going to continue that theme here. So how do regulations keep up with the pace of technology? So there's two main points I want to make about this. One, that there are various ways in which people are making efforts to make certain that regulations keep up with the pace of technology. But secondly, that there are also problems in trying to rush to regulate and to have guidelines and ethical guidance too quickly. So the usual situation, damned if you do, damned if you don't. So that on the one hand, there's acute awareness that ethics needs to be built into the design of technology, or growing awareness that this needs to be the case. Although, from bearing in mind what we've just said about institutions and organisations, building ethics into the design or claiming that you're building ethics into the design could sometimes just be lip service, and it doesn't necessarily guarantee anything. There's growing awareness, there's acute awareness that ethics has got to be not just about the design, but the whole process, and also about the implementation. So there needs to be feedback between the implementation and the whole design process. There are also, for example, in Japan, there are experiments with having local areas where the law is deregulated to try to work out how we can develop law to keep pace with AI as a kind of legal experiment, if you like. But on the other hand, there are concerns about rushing out ethics quickly. As I've mentioned at several points so far, there could be, on the one hand, praise for trying to produce lots of ethics guidance and codes of conduct. A lot of it, though, however, may just simply be window dressing. A lot of it may be ethics washing, trying to make out that we're doing the really right thing, we're producing ethics. We also might worry about trying to produce ethics so quickly that we haven't had time to consider it. So there's a balance between trying to keep pace with technology, but also trying to do it in a way which is sufficiently considered. And there are particular reasons to take great care in relation to AI in particular, in terms of how we're taking enough time to consider the technology, because as we're considering the technology, as the technology is developing, the technology is changing us, it's changing how we relate to each other, and it's changing how we relate to the world. So we need to think about not just the speed of change, but the nature of change and how it impacts upon the nuts and bolts of our experience that feeds into our perception of values, how over time our views and perspectives change. And this is especially so in the increase in our dependence on this technology since the pandemic and the disruption to our lives that makes it harder and harder to recall what things were like before. I was just joking on the phone to my brother that I'm being more or less trapped in my flat for the last year, like many people. It's somehow as if time has sort of stood still, and I could always almost imagine just walking down the road to the flat where our aunt used to live, and going to visit her, even though she died in 1975. So we're living in a really weird time. But I say that partly just to talk about the many, many different influences that can affect our perspective on things. It can be really easily argued that the use of technology, for example, including social media, is acting to hasten changes in values on certain issues. And this is one of the reasons why I always stress the importance of emphasising history and of keeping a long view of things, because we can often forget how things have changed. So, for example, people are often surprised when they remember that Twitter was only founded in 2009. And the world that we see is increasingly a world which we see through the lens of AI and through the lens of a processing of vast amounts of data, including data about us, including, for example, this lecture here.
I was camping in Montana recently, and when you're out at night and you look at that night sky and there's no light pollution, it's just a totally different perspective,
isn't it?
And it gives you a different sense of where you are in the universe, because we're so, and it's not necessarily our fault. It's almost like we've put up a curtain over the heavens and we can't see through the curtain because we've decided that we like light and we like traffic lights and building lights and all this jazz, and we don't realize until we're out in the woods or in the wild, until you're in the wilderness and there's no light pollution, you really don't realize what we're missing and what we're sacrificing in order to have these lights.
Definitely.
The view of the heavens, it's psychedelic in a way.
You bet.
Because it makes you feel like, oh my God, we're really flying through space.
And night.
So Joe Rogan was talking about light pollution. He wasn't talking about AI technology, but it's still actually really interesting, I think. I just came across that clip as I was making this lecture. It's really interesting to consider how different forms of technology are changing our views of the world. And what he was talking about was how we can lose something without even realizing that we've lost it until we go back out into the country where there's no light pollution. And in fact, actually, probably some of the people listening to this will have experience of that. And some of you may never have been somewhere where there's absolutely no light pollution. So I'm lucky enough to have been at camping in the outback in Australia. And it is completely stunning. And this continues our astronomy theme as well, actually. And it also continues the theme. Remember when I discussed a few classes ago, Psalm 8, when we were talking about human nature. And I talked about how I'm imagining David. I know I'm making this up, but when I read that, I just imagine David looking back and gazing up at the stars with a sense of awe and wonder. So one of the things we need to think about is how AI has changed our world and how data use is changing our world. And because it's changing so quickly, we might be able to keep a handle on this. Sometimes you might need to actually really reflect and think back how things used to be. Old people like me are quite handy because we can talk about what it was like in the old days. Sometimes when I really want to impress people, I tell people I actually wrote my PhD thesis, all 75,000 words, in fountain pen. Could you believe I wrote it in fountain pen? It's unbelievable. And you know what actually used to happen? In the old days, we didn't even have a phone when we were little. You know what happened if you wanted to go and see somebody? You went round to their house and knocked on the door. It's absolutely amazing. And I mentioned at a couple of lectures ago, Susan Hogman, a friend of mine, we used to write together. She was a discourse analyst. And she used to moan. This is like real old fogey talk. She used to moan about texts, because people can text each other. They will just really, really flaky about making arrangements. And she said, oh, in the old days, people would write a letter and they would say, I will be arriving in Sydney Harbour on the afternoon of July the 18th. And a person would be there reliably to pick them up. Now we can just text and say, oh, sorry, I'm not coming. That's a bit of a digression. But think about the many, many ways in which AI and data use has changed our world and is changing it all the time. So, for example, here's one example from a pandemic. Many people who have been working at home in a pandemic have realised that they're under increasing surveillance from their work. So some people have found that there's been tracking put onto their computers so that they can even see, like there's technology being developed, so they can take your photograph every 5 or 10 minutes to check that you're actually working at your computer. So that's almost certainly going to change how you behave. It's almost certainly going to change how you behave. So people who are trapped in Zoom meetings at work, it's changing a lot how we think about ourselves, because all the time, one of the ghastly things about the Zoom meetings is that you can see yourself at the same time. We don't normally do that. It makes you really self-conscious. So here I've been looking at these lectures thinking, oh no, I've got a lockdown haircut. I cut my fringe myself. You can probably see it looks absolutely terrible. But those are really, in a sense, trivial examples because I'm making a joke of them. But it's really interesting to see the number of different dimensions in which AI is changing our world and how data use is changing our world. So it's changing what we find out about the world. It's changing how we interact in the world. It's changing what we find out about ourselves. It's changing what other people know about ourselves. It's changing our view of ourselves. It's changing how we relate to other people, how we communicate with them. So the way in which we're thinking of things, these are all node points, because they're all points at which we form our values, how we think about technology, how we think about AI. Technology, of course, has become so integrated into our world that we can hardly escape from it. We more or less have to use it. Otherwise, you'd be not just a Luddite, you'd be some kind of like running around naked, dressed in woad type person. So because it's almost like we're being held hostage by the technology that we're trying to produce an ethical account of. We're trying to think about the value issues. So I've mentioned before, we can contrast two approaches. One approach using high-level principles and values to think about ethics, or to start our thinking about ethics. And a second approach, starting at the ground up, starting with problems, or starting with things which seem to be going well. But as we'll see, as I'll try to explain, I'll try to argue in this lecture, we can't understand one without the other. We certainly can't understand high-level principles without seeing how they might be applied in a particular context. And as we'll see, the use in different contexts is going to give a different meaning, a different gloss, a different understanding to broad-level, high-level principles and values. When we're looking at AI and data ethics, if we're trying to develop new codes and new principles and new ways of looking at it, one of the things we could do is start from scratch, but where do we start from scratch? As I said before, there's no such thing as really starting from scratch. So one of the other things we could do is look around for different areas and see, are there any parallel areas where we can simply use sets of ethical principles, sets of values, sets of ways of thinking about ethics guidance that we can just borrow and apply to the case of AI. And so here we see an example of where there's been an attempt to show how we can take the traditional principles of bioethics, which we can think of mainly as in relation to medicine, the traditional principles of bioethics, and simply apply them to AI, adding what's called a new enabling principle. So this is from a document written by Luciani Floridi, amongst other people, produced by the European Union, and I'll post the link in the description. An ethical framework for AI formed of 4 traditional principles and 1 new one. So first of all, let's look at the 4 so-called traditional principles of bioethics: beneficence, non-maleficence, autonomy, and justice. So beneficence is simply basically producing benefit, and non-maleficence is simply not doing harm. Actually, in medicine, that's often said to be the first principle: first, do no harm. And the claim is we can use these for AI and simply have to add one, which is explicability, a new enabling principle for AI. So explicability could be seen as related to other principles or other concerns in AI, such as it's called transparency or explainability. So that's said to be necessary in AI because of the complexity of AI. Complexity, we'll be having some lectures about this later on in the course. But the concerns with AI are that we often don't know how it works. Somebody might know how it works, but we don't know how it works. It's got a great deal of complexity to it, and often it might be even in principle impossible for us to work out exactly how machine learning is actually coming to the conclusions that it's reached. We'll look at that in more detail later on. So the claim is we can take traditional bioethical principles and simply add one extra principle, and then we'll be able to do AI ethics, as it were. So first of all, just a few disclaimers. These traditional bioethics principles have been, they've perhaps been made most famous through a classic work of medical ethics, Principles of Biomedical Ethics by Beecham and Childress, which is, many of you who are working in medical ethics will have come across this. It's in several editions now. And in fact, actually, as you read through these editions, you will see that actually the work has been changing, that ways in which we think about these different principles have been changing and developing over the course of time, as one would indeed hope, actually, as we think about things in more depth and come across different cases. But also we would say that you would also find differences in emphasis in different parts of the world, actually. So that if you look, for example, if you look at how these principles of bioethics are understood, say, in a North American context, say, coming out of the United States, for instance, and you contrast, say, there's a lot of work in medical ethics coming out of Northern Europe. I've often said that if I had a pile of papers in medical ethics and without the authors on or where it came from, I could almost blind sort as to whether or not the papers came from the United States of America or whether they came from, say, Scandinavia, because of a difference in emphasis on values. So that roughly, as you might guess, the papers in medical ethics coming out of the United States of America, as a broad, I'm generalising obviously, would far more focus on individual concerns about individual patients, and the papers coming out of Scandinavia would be far more likely to mention, not to dismiss individual concerns, but far more likely to mention and to stress community concerns. So that might be one thing you might think that actually is missing if we're focusing simply on autonomy. So the argument that people like Floridi would be making is that these have served very, very well, and these issues all come into AI. So we've already seen, I've already sort of mentioned, I must admit slightly dismissively, calls for AI to produce benefit. And of course, we don't want AI to produce any harm. The notion of autonomy, we're going to be looking at that in a great deal more depth. In the next few lectures after this, we'll be looking at notions of control and autonomy. And that's something which is seen to be, obviously, that's something essential in medicine, but also said to be essential in AI. And we can think of autonomy actually in at least two ways, although it's going to be even more complex than that. Autonomy and control in relation to how we relate to the particular pieces of technology that we've got. So for ways in which, for example, we might be nudged to do certain things online by the technology, or for ways in which people worry that killer robots might develop and take over in some usual science fiction killer robot scenario, or we might be concerned about our autonomy in relation to the tech companies. But hang on, AI is rather different to medicine, and we need to think about this because it's going to make a difference, or it could potentially make a difference to how we understand what the main principles and values are, but also, as I'll be explaining a bit later on, how we understand, how we flesh out what we mean by those values. So that, for example, medicine, the practice of medicine is focused, say, it's focused on your health, it's focused on a certain part of your life, which is a very important part of your life, and it's focused on your body. Of course, psychological medicine and psychiatry is focused on your mental and social realm as well, but it's focused on certain aspects of your life, and it's focused towards a certain goal. It's focused towards the goal of health. Now, as I've said in previously talking about medicine, it can actually be more complex than it first seems in spelling out what that is. But if we take, for example, the goal of autonomy, we will understand autonomy in relation to, in medicine, in relation to physical autonomy over the body, and in relation to the autonomy of the patient as against the power of the medical profession and the need to keep the medical profession working for the good of the patient, the individual. When we're thinking about AI, AI has got an unspecified and general realm of application. So of course we can use AI in medicine, it is being used in medicine, but it can be used in lots and lots of different realms as well. And those particular realms are going to potentially raise specific sorts of issues. So I'd like you to think about the ways in which AI in different fields might differ from medicine and might introduce different sorts of ideas, and whether or not it might impact how we see different principles of values in relation to each other. What was I going to say? Okay, so I'm just quickly going to run over some sets of AI principles that have been drawn up. This is from the Asilomar AI principles. Actually, I don't know how to pronounce Asilomar, actually, so somebody from there will be able to see if I'm doing it right or not. They're called the Beneficial AI Conference. I'll put the link to this in the description box. This is from the Future of Life Institute that I've mentioned before, and I'm particularly mentioning this conference because at the time that this took place, I was actually working on that project funded by the Future of Life Institute, and actually working on a project about how we might develop codes of ethics for AI. And for whatever reason, I wasn't allowed to go to this conference. So out of revenge, I'm posting this picture of them all having a lovely time on the beach. And you can look up the names of all the people who were involved in this, because as one of the questions to ask about sets of AI principles or any sets of principles is who's involved in drawing them up. So it's quite interesting to look at the list of names. Some leading people, lots of people who were working on grants from the Future of Life Institute, but also various other people and other people there. For some reason, Sam Harris was there. I don't know what he was doing there, but he was there. One of their mates, I suppose. So that, for example, to contrast that, the IEEE's set of the IEEE's work on ethical issues in autonomous systems, that the IEEE, to their credit, actually have put quite a lot of effort into trying to get people from diverse backgrounds and from different geographical regions taking part. And it was actually fairly easy to nominate yourself to be on one of their working groups. So amongst the 23 principles, cinema principles of AI, these particular ones from 6 to 18 are actually specifically about ethics and values. So let's have a little look at these. I won't talk about all of them, but one of the things, what I want to talk about is how we understand high-level principles, how general principles, what use they are, and what relationship of our understanding of high-level principles is to actual grounded reality and to the particular context. So this is also actually part and parcel of comparing and contrasting how much we can learn from other areas, how much is distinctive about AI. Can we learn from AI in comparison to medicine? So let's look at the first one, safety. AI systems should be safe and secure throughout their operational lifetime and verifiably so where applicable and feasible. Well, of course they should be safe, but one of the things we want to think about is safe in relation to what? What would count as danger, what would count as risk, what would actually count as a harm? And also, what level of safety do we want? We can think about this actually in relation to the current debate about vaccines, because there's debate about whether or not the vaccines are safe. And of course, there are ongoing ways of trying to determine safety, such as the yellow card monitoring scheme. But one of the things I've noticed that in that discussion, some people are just talking or reassuring and saying the vaccines are safe, full stop, which is actually quite interesting because it's very, very rare to say that any medicine is safe, full stop. So, for example, is taking low-dose aspirin regularly safe? Well, it depends. You had to think about what benefits you might get of a certain group. It's not so safe and it's not advisable unless you're going to get some particular benefit from it. So safety is actually not just relative to what harms might be produced, but it's also relative to what benefits you might get from it. So, for example, we think about driving around in a car. A modern car is actually pretty safe. They're much safer than they used to be. The death toll on the roads has gone down an awful lot in most countries, although it's still pretty high in many parts of the world, actually. But it's safe relative to wanting to use a car. If you proposed if cars hadn't been invented and you introduced the car now, it seems very unlikely that it'd never get clearance because they're so dangerous comparative to just walking around. Although, on the other hand, you would actually have to compare it with things like horses and carts. So whether or not we think of something as being safe depends on what we think the benefits are going to be. And of course, for benefits, when we're talking about medicine, for example, the benefits are going to be in relation to medical benefits. And then the other things that come along with having health, like being able to work and being able to do the things that you want to do, for example. But when it comes to AI is so general because it could have any particular application in lots of different areas. So when we're talking about safety in relation to AI, it actually isn't saying terribly much. So, for example, shared benefit, number 14. I'm always going on about this. About whether the idea that AI should produce benefit, because benefit is such a nebulous concept. And if we look at the notion of shared benefit, AI technologies should benefit and empower as many people as possible. That's number 14. Well, great, bully for them. How are they going to actually achieve this? But also note another complexity of that. If you want AI technologies to benefit and empower as many people as possible, that's tantamount to saying that you want to get everybody using AI and spread it out as quickly as possible to as many people as possible in as many different applications as possible. So then you might think, well, hang on a second, is that necessarily a good idea? Because on the one hand, you're saying that we need to be careful about ethical values and human values. And the next breath, you're saying that we want as many people as possible to have this. So you see what I mean? There's a huge amount of complexity in how you'd understand these principles. Human values, AI systems should be designed and operated so as to be compatible with ideals of human dignity, rights, freedoms, and cultural diversity. It's basically meaningless waffle. To be perfectly honest, it's basically meaningless waffle, unless it's extrapolated into some particular context. So human dignity. So in the context, dignity is a really important concept, but it's actually really hard to pin down. You can often recognise when human dignity has been violated. So, for example, actually there's some work a few years ago, not so long ago, in medical ethics saying that human dignity was a useless concept. But I think it's a really useful concept because we can often really tell immediately when dignity has been violated. So, for example, on a hospital ward, if you met an elderly patient on a hospital ward who'd been admitted and was lying in a bed, half naked, half undressed, in their own, maybe unsoiled and not cleaned up, and everyone's ignoring them, we would instantly recognise that as a violation of human dignity. In relation to the use of AI, because things are changing, technology is changing so much, you might wonder whether or not certain things are a violation of dignity. So if you go back to the example I used before of people having surveillance put on their computers so that the people at their employers can tell whether or not they're working properly and monitor them. I mean, might argue that's a violation of human dignity, actually, but depending on how we understand it, it's going to be different in different contexts. And of course, the last point I'll make about these is that they say nothing about how we're going to achieve any of these. So look at 18, AI arms race. An arms race in lethal autonomous weapons should be avoided. Good, good. It's a bit like saying, play nicely, children, without giving them any idea about how to play nicely. Sorry to be sarcastic, I must stop, sorry. So here's a smaller set, the European Union high-level expert group on AI. That always sounds good, doesn't it? European Union's got different levels of experts. There's high-level experts, and actually I was on a couple of committees last year where we were just experts. We weren't high-level, we were just ordinary level experts. So the high-level expert group on AI has 7 key requirements for good AI. So this is an interesting list. From number 1 to 7, you can read them through yourself. People producing PowerPoints are constantly told that they shouldn't put too much on a slide, but you can always just pause it and read it if you want to. One of the things I'll point out about this is that last year the AI for People, I'll put the link below, had a set of working parties looking at how you might integrate these 7 or apply these 7 key requirements for good AI in different concrete use cases. So, if you like, setting out these principles, setting out these 7 very broad values is of no use really unless you can actually see how you can integrate it in different areas. I was working on one committee looking at AI and healthcare, another looking at AI in relation to media and technology. So these are very, very broad areas. And something else to note is that these are not listed in any particular order. But if you're going to have a set of 7 values, then there's going to be cases when the values are trade off against each other, when they clash, when you can't fully have all of the different values together, and where some might be more relevant than others. So if you're going to have a set of 7 values, you're going to have some way of trying to deal with conflict and compromise and trade off. So here, for example, in this report from the Leverhulme Centre for the Future of Intelligence, which is based at Cambridge University, and the Nuffield Foundation produced this report 2 or 3 years ago, Ethical and Societal Implications of Algorithms, Data and Artificial Intelligence, a Roadmap for Research. And one of the key things that they pointed out in this report was that there are going to be tensions between the different values and different principles, and they need to be worked out in context of application. So how we understand control, for example, will be different depending on what area it is, but also the background issues that led to it. So, for example, there are going to be historians and political theorists who tell me this is an oversimplification. But if we look at notions of religious freedom, comparing England and France, with their quite different histories, actually, the notion of freedom, religion and freedom in France is freedom from religion. So it's for freedom not to have any imposition from religion, from the interference of a church in the individual's private life. Whereas in England, because of different history, the notion of freedom around religion was the freedom to practice a particular religion. So the freedom to practice a particular minority religion, or to be Catholic or Protestant or some other religion. So that has a quite different complexion in how those different understandings of freedom play out in a political context. So I know whether or not that particular example is historically accurate, and those things are always much more complex. But we can see that in different contexts and depending on the different background assumptions, then how we understand the particular issues are going to arise. So we've seen that privacy in relation to AI is one of the values. Well, we're going to have some lectures on it later on in the term. We'll see later on in the course. You'll see that there are many different ways of understanding privacy, and how we understand privacy depends, again, in part on what we expect and what the history is and what the particular context is. So now let's just summarise some issues about some guidelines. This is from, I'll put the link in the description box. This is from an article which was published a year or so ago, of a report looking at different codes of ethics and guidelines around the world, looking at the geographic distribution of issuers of AI ethical guidance by the number of documents released. So as you can see, it shows very, very clearly that the documents are concentrated very, very highly in certain parts of the world. The brown block for Europe, I'm assuming that's for the European Union because I doubt if every single country in Europe has produced more than 15 guidelines. As you can see, it's really concentrated in certain parts of the world. So this is one of the reasons why it's really important to bring people in from different parts of the world, because everybody is going to be affected by these issues. We might actually issue some congratulation to the restraint of Australia, India, Canada, and South Korea, I think, who have produced only one set of guidance. Well done, folks. Look at North America and Europe. It's just proliferating. And the authors of this paper looked at the ethical principles identified in existing AI guidance and did this really useful table counting out of 84 sets of AI guidance that the number of times that a particular ethical principle was mentioned. Now, it's interesting that transparency, which is very, very close to the notion of explicability that Luciani Floridi mentioned, comes out as the number one, is mentioned in 73 out of 84 documents. And of course, you won't be surprised to see that justice and fairness and non-maleficence are mentioned highly as well. One of the things I was a little bit surprised about is how low down on the list freedom and autonomy are mentioned. But we'll talk about that. We'll talk about that in subsequent classes. So to reflect, how do we develop codes of ethics, and what is the relationship between high-level principles and concrete practice? Well, I hope I've tried to show to you that there are very, very strong relationships between high-level principles and grounded practice, because unless a high-level principle can be understood in ways that we can apply it, then it's not really going to do any good. I've also tried to get you to think about how we might learn or not learn from the area of medical ethics. And in the class before this, for example, I went through some of the features of the practice of medicine and the way in which it's grown up and the disciplines and practices around it, which together go to help to ensure that there's at least a reasonably high standard of medical ethics. Obviously, there could be slip-ups and abuse, and obviously it's a developing area, and there's always going to be grounds for critique, but there's a reasonably well-grown-up way of doing it, well-developed way of doing it. And when we're thinking about the whole point of having a system of medical ethics, or any system of professional ethics, would be to try to match the power between the profession and those using a profession. So in light of the potential power of the medical profession and the relative lack of power of the patients, there's grown up a way of medical ethics to try to give the patients more power and to make certain that the medicine, the profession is practiced for the good of the patients, or any profession like engineering is practiced for the good of the clients. And in relation to medicine and many other professions, one of the ways of doing that is that you have to be properly accredited, part of a proper professional body, gone through proper training, have to keep up training, also have to actually be aware of the codes of ethics and obey various aspects of law and safety and so on. So there are ways of ensuring this. And so far, that doesn't really exist at all in relation to AI. Anybody can produce it. Anybody with a spare £1 billion can set up a social media company. There are all sorts of ways in which AI can be used in ways which can have great power over our lives. But very often we don't even know that AI is being used or exactly how it's being used, which of course is one of the reasons for the concern about explicability or transparency in what's going on. So there's a long and rocky road ahead in whether or not we're ever going to be able to have anything which matches the kind of developments of codes of ethics that we see in areas like medicine or in the engineering profession, for example. So to reflect, the last reflection we're going to look at, I'm going to leave you with another video clip from Alan J MacDonald talking about his lessons that he learned from the Challenger disaster, as we reflect on how it is that we can actually try to ensure that, how we can ensure good behaviour, how we can ensure that people keep to standards of ethics and safety.
One of the big disappointments I had after going through all that, and a lot of the lessons that were learned from Challenger were fairly well implemented immediately after, but they carried over to a point where they finally were forgotten some 17 years later. When they launched the Columbia that year in 2003, they clearly saw on the film this huge piece of foam, it's called ramp foam, off the tank impact the orbiter. And it actually impacted the leading edge rather than under the tile and shattered. They then ran some analysis of what that impact damage could be, and they had the fanciest, most up-to-date computer model there was available at that time in 2003, and concluded that the damage wasn't significant enough that they couldn't return home safely. There were some engineers at Langley that didn't feel comfortable that that was the case and said, well, we can find out for sure by asking the Department of Defense to turn one of their spy satellites towards the orbiter in orbit, facing towards it, and it will see it in spades if it has significant damage that it would be a catastrophic reentry. So they made a specific request to the mission management team to do that. And it so happened that the mission management team declined that request on the basis that they'd had an analysis done by Boeing on this crater model computer program that was the most fancy thing in the world, and that they don't feel there was adequate damage, so they didn't need to go through the protocol and all to make a request to make these pictures. It was the first time in the 50-year history of NASA that I saw they went from a can-do attitude to a can't-do, and that was the most serious mistake, the most unethical mistake I think they probably made in their entire history. One of the lessons learned I tell students also is this: don't always believe in all your big computer programs. Use your gut feeling and some back-of-the-envelope test of reasonableness checks on some of those answers, because that will give you far more confidence. And I tell you, some people have better judgment just saying, you know, it doesn't smell right, and you need to do that. And so that's the other lesson learned. And don't presume anything. If you think it's important, make sure that what you thought was important got to the right people. So that's what I wished I would have done.
Thanks for listening.